I'm going to talk a little bit about communicating with your policymaker. And there's a reason for that. It's because I had my very first introduction to communicating with my policymakers back in March at the Health Education Advocacy Summit. As I said before, I will plug for it. It was a wonderful experience for me, both the getting prepared for it ahead of time and then also just the experience, of course, being there on the Hill. So we still have a lot of health educators in the room, right? Raise your hands for your health educator. Okay, so quite a few of us, and as you know, communicate and advocate is one of our areas of responsibility. So just the cool thing about taking pictures with your phones is I just added this one picture yesterday. This was Opportunity Nation. We had 8,000 middle school students on campus yesterday in the orange shirts. And up on the stage there are a bunch of health educators, some of whom were sitting here earlier. Kristen and Samantha were there. But we were, in this picture, communicating and advocating for the profession because we were trying to encourage all these young people and motivate them to, hey, you're seventh graders now, but one day you could be up here just like us. And you wouldn't believe how excited kids get when, seventh graders really like it when they see young people like Kristen and Samantha who are like, hey, I went to such and such middle school. Woo, so did I. So that was pretty cool. And then this picture, here's Suhei, one of our health educators who's now in the MPH program. And there she is communicating and advocating for health and health education as part of her doing nutrition education at the Boys and Girls Club. So communicating and advocating comes in all kinds of different forms. I just added this one about a half hour ago. When Jerica was making the jokes about Michelle Obama this morning, I had met her before and never made I didn't do the you look like Michelle Obama thing. I just thought, Jerica, nice to meet you. I thought she was very beautiful, but Michelle Obama did not enter my head. Until the second time I saw her, she was in that dress. And I was like, now I get it. That's your Michelle Obama dress. And I had so much fun with this picture. When it's up on the stage, it's Jerica, not Michelle. But let me tell you, when it's on my phone and I show it to my boss, and I say, look what I did in DC, you should have seen the looks I got. Woo! I probably showed that picture 20 times to anybody who was above me, like, you send me to DC and look what happens. That's who I spend my time with. So thank you, Jerica. I thought I was going to get a raise out of it, but I couldn't keep the deception going for long.
Can I tell a story quick?
Absolutely.
One of my favorite advocate stories ever is that we do a federal lobby day every day with about 800 advocates. And this was obviously years ago. This woman comes up to me, and I just met her, but she was the nicest. She was about like a 60-year-old woman. She comes up and she said, I can never wash this hand again. It was right after President Obama had been elected. She was from Chicago, and she had gotten to meet President Obama for the first time. And she was serious. She came up, and I didn't really know who he was at that point. He was a new member from Chicago, but I thought that was so cool. I was like, I can never wash this.
So you scored me lots of cool points when I got back, Jerica. Thank you very much. So again, just to point out, communicate and advocate for health and health education is one of our areas of responsibility as health education specialists. So I'm going to talk a little bit about Jerica talked some on communicating with policymakers, but sometimes, the very basics, first we have to identify them, right? We have to know who they are. And that can be a challenge sometimes when we're working on a lot of the policies that we work on. So, sometimes we don't really know who has the influence. And when we were on the Hill, it was easy because, we knew who our congressional representatives were. We had the issues in front of it. We didn't have to do that, gosh, this is an issue I really care about. I want to figure out who's making the policy here. But just locally, we had a couple examples of that recently. With the Great American Smokeout in November, we had a lot of different agencies participating in an event on campus. And some of the students were trying to figure out kind of the campus climate on becoming a smoke-free campus. There's close to 600 smoke-free campuses across the country, and so it's a growing movement. But when the students, and they were in a health education planning class, and when they started out to say, at first the students were like, hey, let's go advocate for this. We want to make UTEP smoke-free. It was tough to A, find the policy, and B, figure out who the policymaker was, because if you can't find the policy, how can you figure out who the policymaker was? It literally took the students a week, and several of them were working on it. There's nothing, they Googled tobacco policy or smoking and Googled stuff on the UTEP website, couldn't find anything on the university website. They emailed the Vice President for Student Affairs, they emailed the President, they emailed all the logical places you would think if we have a tobacco policy here on campus, so-and-so would have it, because they wanted a copy of the written policy. And it took literally a week for somebody to say, you know what, actually, we don't have our own policy. We follow the UT system guidelines, and that took another few days to figure out where those were posted, and they weren't posted anywhere on the UTEP website. You had to pull them from the UT system website, and it was from a 2002 policy, which essentially the gist of it is something like you can't smoke in buildings, but it's definitely not a comprehensive policy. So that was step number one, was find the policy and identify the policymaker. And so then it got a little fuzzy, because who is it up to decide that policy on the UTEP campus? So always figure out who your policymaker is first. Once you've identified that person, and if they're the ones that you're going to do your communicating and advocating with, as Jerica mentioned before, sometimes those first couple steps or those first couple meetings, it's really, it's always easier to advocate for something when you have an existing relationship with someone. And part of that, because you're the one, they're out there doing their everyday, you are not on their radar screen. If you've got your sights set on them as somebody you want to talk with and somebody to influence, you need to do some homework and find out about them. Know what their record is. When we went on the Hill, I kind of had it made, because APHA, is that APHA that puts out the voting record? Puts out a really nice little short, small paperback book, and it's basically a voting record of how all of our representatives have voted on issues related to public health going back 6 or 7 years, 10 years? Going back quite a ways. So some folks, if they lived in other parts of Texas, were doing their advocating with people who had never ever voted in support of anything that public health people think is important. And so that was, it's very important to know that if you're going in a meeting with somebody, to know if they have consistently voted against everything you stand for a decade, versus our local representative. When I met with Congressman Reyes's legislative aides, they have a consistent voting record in favor of almost everything that is public health related and the kinds of things that us and our agency supported. So it was very different preparation, very different conversation. I definitely started off with, first of all, I said something like, I know I'm preaching to the choir. I very much established that we appreciate it as health educators and public health professionals. We appreciate that kind of support. So know their record and know the issues they care about. Even if you're going in to talk with somebody who has consistently voted the other way and has a long history of that, if you know the issues that are important to them, it gives you a place to start, it gives you some small talk, some place to build a rapport, rather than just starting off, jumping right into the, here's what we want you to do, and you've never done it before, but we want you to do it now kind of thing. If you can develop that kind of a relationship, it'll be much easier to talk about what you want. So, and again, that goes back to what they covered quite a bit this morning. Know your issue. Know it backwards and forwards. Know it in the 30-second, 60-second elevator speech version, and know it in the, you have a chance to have dinner with somebody at a conference, and you get the chance to talk with them for half an hour or an hour. You should know it. I mean, that's the kind of, I think if we want to be effective advocates, that's how well we need to know our issues. When I was at the summit, it was one of the biggest challenges for me was taking a fact sheet, and the one Jerica showed you about the ESDA, also known as the No Child Left Behind. That fact sheet, those issues were a little bit familiar to me. Some of the other ones that we were advocating for were not. And so when you're starting from scratch with an issue, it's tough to learn it, to be able to speak articulately and passionately about it. And I literally, my poor husband, because I went back to the hotel room that night, I was like, honey, I got to practice. And I was like, so he listened to me, 15 times talking about these different issues until I could talk about them and sound like I was educated about them. Because sometimes that's the way we have to do advocacy. We may not have the luxury of months and months to prepare. We may be in a situation where you're like, you know what, this bill is really important. You guys need to, this is important to the cause, and we need to get familiar with it, and then we need to convince somebody else that they want to support the cause too. So know the issue, know what you want. As Jerica said, it's very important to give specifics about what you're there to ask for. Are you there to just build a relationship? If so, that's kind of a different conversation than if you're there to ask them to vote a particular way on a particular bill. And so in a brief or a fact sheet, it can be very useful to put that right up front. And sometimes when you're speaking in person with somebody, it can be very useful to put that right up front too. Say, you know what, I'm Holly and I'm here today because this issue is really important to me, and get it right up front. Tell them right then they know what you want, and they're kind of thinking that way. And then you can back up your evidence, support it, and repeat it. Remember, this is all about this bill. It's coming up, blah, blah, blah. We really need your support on this issue. You want them to understand who you are and what you do. I find as a person, if I'm talking with somebody and I know something about them and I know something about their passion, it's much easier to, you find yourself aligning yourself with them. Even you may have never heard about their issue. I didn't know anything about some of Frank's issues and concerns until I met him last week. And boy, he sold me, in 5 minutes of talking to him. I thought, wow, this is a really important issue. And so, and it was in an informal setting, but because I knew a little bit about him and I knew a little bit, he had explained a little bit about why it was important to him and how important it was much easier for me to think, oh, yeah, that's, I should care about that too. So, not that everybody will always agree with you, but I think as advocates, the nice thing is when we get people who, at least they understand why we care. They may not be able to do what we want, but they may be able to walk away thinking, I can sure see why they're so passionate about this issue. And maybe they don't have the power or whatever, or it's not the right climate, as frequently happens in an election year, to do what you want right then, but they'll remember you the next time you come back. So stories, we've talked about this today. And Joanne, I think you said something about putting a person behind the story or personalizing it or humanizing it. Sometimes when we do advocacy, especially in health education, we do a lot of research and we look a lot at population level data, and we say, we give them all of these facts and figures. And I came across this article the other day called Eliminating Health and Healthcare Disparities Among the Growing Population of People with Disabilities. And it's all about integrating health disparities and advocating for people with disabilities, and there's a lot of research behind it. It would be a very useful article if you were writing a policy brief. But what would also be very useful and turn these numbers like 48 million people, and especially if you're advocating as a constituent or if you're visiting your representative and you start throwing statistics about 48 million people to them, what are you going to want to have for them to remember you? What would help? A personal story, woohoo, yeah. Yes, humanize it, personalize it. Say, if it's not me, if I'm advocating on a certain issue related to people with disabilities, I may not have my own personal story, but I'm going to be much more effective if I find out Joanne's story. And I go say, you know what? This is one of your constituents, and this is the difference that this bill would make. This is how it is now. This is how it could be. Or this is the benefit that somebody has received because of the Prevention and Public Health Fund, or because of, whatever the issue is. If you can find some way, we have a lot of people from International AIDS Empowerment here. I'm sure they could educate us all on the needs of people living with HIV. But what's going to hammer that message home to somebody who may not have the level of expertise or the level of education about people with HIV is talking about somebody with HIV and how a particular bill or issue might affect them. Because that somebody, those legislators that we always like to make fun of bureaucrats, right? But they're people too, and they have families too, and guaranteed, people have. You want to leave the room and have them think, that could be about my grandma, or that could be about my 6th grader, or that could be about my neighbor. So whenever you can, take those numbers, take those 48 million and turn it into a story of either the harms or the benefits that can come to people. So you want to make yourself the go-to person also. And if you develop those kinds of relationships, the next time something comes up, or the next time, Jerica's my go-to person when it comes to public policy. I'm like, ooh, Jerica, what do you think? So, and not like she cared whether I felt that way about her, but that was just the kind of, that's the kind of rapport we developed and she made it clear that, anytime you need help or, anytime you need resources, and so I'll shoot her email all the time, say, what do you think of this, or where can I find that? And that's who you want to be to your policymakers, is you want them when there's things on the floor that they're going to be voting on, or there's policies that they can influence, you want them to think of you and say, you know what, that guy Tony Martinez from International AIDS Empowerment, I met him last year someplace, and he offered if I ever needed any information about people living with HIV or how this bill was going to affect people or what the impact would be in our district, he said I could call him. So now, Tony's got the floor, and he's hopefully got some good policy briefs put together. And but that's the kind of, if you kind of have that in your head that if nothing else today, I'm going to walk away and have that person think, you know what, next time I want to know something about diabetes, I'm going to call that guy Henry in El Paso because I know he'll be able to answer my questions, and he'll be able to give me information about what this particular thing would mean for my district. So, and then just don't make it a one-time thing. Send them updates. Tell them stories. Tell them, it sounds like Joanne was in DC, so when she got back, if she, she can, that's what I'm looking for. She can take that one trip and get as much mileage out of that as she can by continuing to tell stories about it. That might have been a weekend. Okay, so yeah, so that was a one-time trip, but she can talk about it. And she can talk about it 10 times a day if she wants to, but she can talk about it to whomever and wherever she can, and that's a good thing to do. It just helps you be a better go-to person, and it helps get your message across. And share ideas and information. When you get information you think might be useful, I get things from you guys sometimes all the time, which is really awesome. Somebody will forward me something and say, I thought you might be interested in this, or I know you work in this area, so I thought you might like this. I'd much rather get something twice than not at all, or 10 times or not at all. So share that information. Too many times I think we think, they already know that, or somebody already sent it to them. So this you've already seen, and I put this in there as just an example of sometimes of making, of course this isn't my example, but this is what was shared with us at the Hill. And I'm happy to share this. These are like public documents on the Sophie webpage. If you're not a member, I don't think you can access off the webpage, but I can send it to you. But it's a good example of how you can take your issue and put it on a fact sheet so that you can hand it to somebody and they can walk away. It's also, I think, writing a fact sheet, and I realized this after the summit thing, writing a fact sheet like this is a great way for you to educate yourself, because it's kind of just like being back in school. I was by no means an expert on the impact of the ESAEA or No Child Left Behind and some of the provisions in it. If health education and physical education are put in as core subjects, then school districts can use Title I funding to expand those programs within the schools. And it's really it's a big issue for us. And it won't happen this year because it's an election year and nobody wants to touch it. But it doesn't have to happen next year. I think it's...
Well, it was supposed to happen years ago. It was supposed to be reauthorized every 5 years.
And they've just been putting it on hold, right? Mm-hmm. So sooner or later, and that's a big issue for us, for health educators. But whoever wrote this fact sheet guaranteed had to do some research, and they had to put it down on paper, and they got smarter by doing it. So I would encourage you all, that's kind of, I'm walking out of here with one of that as my personal challenges. I'm going to make fact sheets about a couple issues that are near and dear to my heart so that my elevator speeches will be better. I'll be able to communicate the importance of them better to people. And I think you can see this, but one of the things I really liked on this one was they made very clear on the back, they had talking points. What's the need? What's the concern, and what's the solution? And again, for a second issue, solution, what's the need, the concern, and the solution? And that was a real good way for somebody to say, you know what? A lot of schools today don't provide health education and PE. If they're not core subjects, then they're at risk of being marginalized and cut, just like arts and civics and things have been lately, or just because there's not enough funding this year, therefore PE is going to go. So, and then there's a solution. Ensure that the reauthorization recognizes PE and health education as core subjects, which ensures that schools have the option to use Title I and Title II funds for physical education. So right there, need, concern, and solution. So it's something they can look at. It's something, that's the kind of thing that would be good to know before you walk in there, regardless of what the issue is, so that you can say it. And I just thought I liked the way that they laid it out there. So sometimes we talked about, I think Jill mentioned the action alerts. Who gets action alerts from any organizations that you're a part of? Okay, so just a few. That's cool, because if you all raised your hands, I would have been like, oh no, took the wind out of my sails. But action alerts are things that if you belong to an organization, in this case, Society for Public Health Education, you can sign up for, or if you're a member, you automatically get them. But you can request to be on any number of them. Sometimes you don't have to join organizations. They're just out there around certain issues. But they're just, you get an email in your inbox that says, hey, guess what? This is being voted on tomorrow. Your legislators need to hear from you. And it's, how much easier can it get? Right in my email inbox, it says, call your member of Congress. And then if I don't know who that is, I can even go to the link and look it up if I have forgotten. And it gives me some talking points. And then it says, hey, for more talking points, here's where you can go. And so right in my inbox, and all I have to do is pick up the phone and leave a message or send an email or however you communicate with your policymaker. But all the information's right there, and so if you're a passionate advocate, there's no excuse for not responding to these action alerts. And if you don't get them, join some organizations that have them, and just Google action alert for whatever the issue, and I'll bet you'll find some place that will be happy to oblige. it's a great way to maximize, that one person, the CEO of Sophie, sends this out, and now all of a sudden all the Sophie members can, and that's what Jill meant when she said they want us to turn off the action alerts, because hopefully if I forwarded this to everybody in the room and said, hey, you guys, call Congressman Reyes' office tomorrow and leave a message saying this, and if 60 people did that, this is a small community. He probably doesn't get 60 phone calls on one issue in a day. So, but you multiply that at the national level or by the social media level, and all of a sudden you can see how powerful this kind of thing can be. So Society for Behavioral Medicine just started sending some of these out they've sort of just recently moved into the policy realm. So just here's another example. They sent me an issue. They said, hey, we're voting on this Tuesday, Friday, April 27th. If you feel similarly about this issue, click on the link and go to the Policy Tool website. Call to find out. Again, the information is right there. It's easy to click on. So it's kind of a no-brainer if you want to do it. When you do click on that link in the previous email, I thought this was really cool. They have a link to the Prevention of Public Health Fund. So if you weren't sure what it was, you wanted to read more about it, it's right there. If you don't know who your legislator is, again, they have this little tool. You type it in, you find out. And they even give you a template letter. So you can literally copy paste it into your email or into a contact form with your legislator and communicate that information. So don't overlook the form email action alerts, because it can be a great way to educate yourself about an issue. And of course, you always, if you can take the time to personalize it, great. But even a form letter is better than no letter, because they count those. If enough constituents of theirs feel a certain way, they pay attention. But again, it's always better if you can add a little something to personalize it at the beginning or tweak it so that it reflects your feelings. Who recognizes this? Anybody? The Sistine Chapel. I would have said the same thing too prior to March 2nd. Who? Oh, I don't know if it looks like that in Austin, but it definitely looks like that at the Capitol in D.C. No. So I don't know. I have not been to the Capitol in Austin, but that is the dome of the Capitol in Washington, D.C. So, which I had not seen before March, and it's amazing when you're standing underneath it and looking up. And that picture was just from my phone, so I'm sure there's better pictures of it out there. So there's outside. That's the painting is right up in there, and when you're standing in there, you look up, and that's what you see. I guess it's like being in the Sistine Chapel, which I've never been to. But so here's a picture of me, and I'm showing here two different forms of communicating and advocating, because like we said, there's a lot of different ways, right? We can call, we can visit, we can email, we can send letters. But here's me on my first ever visit to the Hill, and this is Lorraine Carrasco, and she is the the Congressional Caucus Fellow, and she works in Congressman Reyes' office. So she was one of the ones I met. She arranged, as a constituent, if you go to DC, I highly recommend you call your representative's office, because they will take the time to meet with you and give you a tour of the Capitol, and it's amazing. As my first visit on the Hill, I'm speechless. It really was that kind of an experience. So I highly recommend that. So that was my form of communicating and advocating that day. I had a 15-minute meeting with a legislative aide, not Lorraine. This being El Paso, though, the legislative aide that I met with, 5 minutes in the conversation, we realized that he was the nephew of somebody I work with, and it was kind of funny, but yeah, this is El Paso. So I had a 15-minute meeting with the legislative aide to my representative, which was a very pleasant meeting. Again, they have consistently voted in support of public health issues, and so it was more of a just get to know you. If I can ever be of any assistance to you with things regarding border health, please let me know. We really appreciate your support. And I spent time talking about some of the materials, but for me it was really more about the relationship building and highlighting some of those issues, because they have consistently supported public health issues in the past, and I didn't want to just say, hi, I just met you, and this is really important, but I definitely also wanted to communicate that there were 30,000 people behind these things, and that there were a bunch of people in El Paso behind these issues, and that we have a chapter of the Society for Public Health Education here in the border region. So that was my form of advocacy. Here's another form, which is kind of cool, because we have I don't think anybody in the picture is in the back of the room, but these are people in September, I believe, in DC, demonstrating on My Medicaid Matters. And one of the oldest forms of advocacy, right? Take to the streets, in your face, we're not going away. I guarantee you this had a bigger impact than my meeting that day. More people, more, a louder message. both are really important. I mean, sometimes we forget. I think we get stuck in our own, in the types of advocacy that we do most often that we're more comfortable with. And not that everybody should be, super versatile and do everything all the time, but don't overlook different types of advocacy, because for some things, this might be more effective, a one-on-one meeting with the guy that's actually doing the vote. For other types of things, and when your issue is at other types of phases, this might be much more effective. So, never overlook the power of the types of advocacy that you either haven't done yet or you don't know how to do. And like a lot of the other things we've said today, join forces. How cool it would be if this type of advocacy and this type of advocacy around the same issues were happening. It would, this sometimes can be used as that was probably on TV. How many people saw that day versus how many people paid attention to my visit? So, again, it just depends. Sometimes the one-on-ones with the one who's actually doing the voting can be more effective, especially, did you want to add to that?
Yeah, I was just going to say, and sometimes, policymakers themselves participate in actual demonstrations. And again, it probably maybe not makes the news everywhere, but sometimes I see on news in D.C. members of Congress getting arrested. The mayor of D.C. gets arrested all the time. He's part of several demonstrations. I think it's on his schedule several times a week to get arrested. So, so members actually participate. They take to the streets as well. So.
Yeah, I mean, there is power in all types of advocacy. So just, today we've really focused more on the policy brief and the polite side of advocacy and the individual side of advocacy, or not even so much the individual, but how can we do it better as ourselves and then as small groups or as El Paso. But the Million Man March, I'm thinking of other things recently where there've just been lots of people. So so just be familiar and think about what's really best for your issue at that time.
Organize.
Yeah, organize. Go back to the beginning and organize. So these are just a couple of quotes that I really like. The person that presented on a couple of things at Sophie had this on their PowerPoint, and I loved it. So it's such a good motivating thing, when you're trying to do something and you think, oh, it's just little old me. But never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So I just really like that because, we're just, most days, that's what we are, a small group of committed citizens. And but if we organize, I think we can have a bigger impact and we can make the kinds of changes we want. And then the other one I really like is always it doesn't matter whether it applies to education or to health or just life in general. Washing one's hands of the conflict between the powerful and the powerless means to side with the powerful, not to be neutral. And if we're advocates, when we're advocates, we have that voice. So a lot of times we have that voice because either other people don't, sometimes they can't, sometimes they're too busy, sometimes we have more resources, sometimes we have more opportunity, but we have voices, and we also have the ability to help other people become advocates too. So if there's any takeaway message that you all leave with today, I would say it's, use your voices loudly and wisely on the issues that you're passionate about, and bring others into the fold. We're all here because we care about policy advocacy to build health equity. There's a lot of people out there too that probably would if they knew what we know, or if they knew what they could do to be an advocate. So share what you know and share with each other. And I hope, as we've all talked about today, that we keep this momentum going. Sometimes that we all talk a good game, but then we leave and we go back to work and we don't keep up with it. So I would challenge you all, including myself, to keep up with it and become the strongest advocates that we can. I want to thank you all for being here today. It was just awesome to get to know you and see you and find out more about what your concerns are and what you're interested in. And I think we have some good steps to move forward. If it's okay with everybody, I'm just going to send some blanket emails to everybody that registered for the conference asking, would you be interested in this? I'll send out that email, and then you can decide from there whether you want to kind of be on a regular email list about policy advocacy issues and forums that we might have. And feel free to email me or call us at the Hispanic Health Disparities Research Center anytime if you want more information, if you want more resources. We should have these posted on the web in about a week, the PowerPoints from today, and then I have some more resources that I'll share too on the web. But thank you so much, and thank you, Jerica and Jill. We really appreciate you.